Hi, my name is Dr. Erich Acebedo. As you know, my background is in internal medicine. I've been doing this for years. And on top of that, I did advanced courses in integrative medicine and functional medicine. And also with that, I trained with Dr. Thomas Rao of Switzerland, which is the Paracelsus Clinic, which is famous in Europe. It's located near Zurich, Switzerland. And to give you a brief background on Swiss biologic medicine, for those of you who are not familiar with, so it's an integration of Ayurvedic medicine, traditional Chinese medicine with European homeopathy. Along with that includes phytotherapy. So they've been doing this for years, and part of that workup includes live blood analysis and some other functional blood tests that we do, as we typically what we do in integrative functional medicine. I've been doing this for years now, and I'm part of Dr. Canila's group now, who, again, as you know, they've been doing also integrative functional medicine for 30 years now. So being part of this group is really phenomenal, that we have a lot of practitioners here that does a lot of stuff. And one of the things that I do as an internist is do a complete physical exam approximately yearly to prevent disease from happening. And here in this practice, we do comprehensive analysis of the whole person, to prevent a disease from happening, which is 5 or 10 years later. We look for inflammatory markers, and we have, when we do here psychological testing, which we call evox, and we want to find out what emotional component you have that would affect your disease and your healing process. So we also do the bioimmune survey, which would determine if you already have a brewing disease that we cannot find in a regular blood test. And as we know, the regular blood test that we do in conventional setting will not see the whole picture of what you're having. So here in our practice, we do this kind of stuff. In the bioimmune survey, we do a psychological testing, as I've mentioned, and we do comprehensive blood test. It involves looking at inflammation, which is the common pathway for all chronic diseases, and also look for gut diseases. Now there's been tremendous research on the gut microbiota, and we now know that chronic disease are related to gut dysbiosis. We also do we look at leaky gut. And in fact, a lot of chronic diseases are related to leaky gut. So, for example, let me go to specific disease entity that most commonly we see in practice. So, for example, heart attack, pretty common. Now, I just have a code here that a friend passed away, I believe a month ago. I was told that she was completely healthy, doing exercise, and watching her diet. And unfortunately, she passed away. All of a sudden, and the autopsy showed she died from heart disease. What could have been done for that? So, in internal medicine, we look at the risk factors, and a lot of these factors are the following. So hypertension, diabetes, hyperlipidemia or cholesterol elevation. We look at the stress. Again, that involves, emotional aspect of the disease, and age. Smoking is another one. We know that sedentary lifestyle is new smoking. So we'll look into these whole risk factors that you've got, and then what are we gonna do next? So we do comprehensive blood test. Now, the thing that we do when I was an internist, conventional doctor, we check the file, which only measures the HDL, LDL, the ratio. But now we know that there are what we call particles. So the LDL has small LDL particle and a large LDL particle. Small LDL is the one that is atherogenic. So we do here blood test that checks your small LDL. There are some other parameters that will look at LP, little a, and then the PLA2, oxidized LDL. So these are the things that we look at to determine if you have, either an existing plaque that is building up now, and we need to do something for that to minimize the future risk of heart disease, heart attack. And then on top of it, we do carotid intima thickness, where we measure your carotid ultrasound, and then we see if there's some thickening of your carotid intima. Intima is the lining of the blood vessel that is affected in heart attack. That's where the plaque starts to build up around. So what I would do, I also check homocysteine level, which is very important. If that's elevated, that's also a risk factor for heart disease. And I noticed over the years that I'm practicing, is homocysteine is elevated, I also gonna check the MTHFR, or the methyl tetrahydrofolate reductase gene. A lot of my patients in the past, pretty much 90% of them has MTHFR defect or mutation. And what that means is you have a methylation problem. So you cannot methylate, or essentially you cannot detoxify, and that also leads to DNA, RNA defect. If you have that problem, we need to find out. So by knowing that, we know what to do to lower your homocysteine level. On the cancer side, we found out that these patients who have MTHFR defect cannot process the estrogen. So much so that they start to build up the 16-hydroxyestrone, which is the bad estrogen. That is a risk factor for cancer, especially for breast cancer and for prostate cancer. Those are hormonally driven cancers. And so it's very important to have that test in my part, because now I'm with any breast cancer patient, any prostate cancer patients, I'll check that to make sure that the 16-hydroxyestrone is elevated. I want 2-hydroxyestrone, which is the good estrogen, to go up, and 16-hydroxyestrone goes down. And there's ways that we can do that, which I'm going to go into details. Of course, we're going to look at the vitamin D deficiency to see if you have that problem. Omega-3 levels, omega-3, omega-6. Then we measure gut dysbiosis, leaky gut. I found out over the years that those patients who has pancreatic enzyme deficiency or they're hypochlorhydria, or people who are not producing hydrochloric acid, is prone to develop what we call SIBO, or small intestinal bacterial overgrowth. And again, that leads to gut dysbiosis, chronic inflammation in the gut. We also do food sensitivity test, which I do pretty much in all patients, especially cancer patients. We want to lower any inflammation that is going on in their body as part of their healing process. In my background with Swiss biologic medicine, we emphasize so much on the dental or the focus of infection in the teeth. So Dr. Thomas Rao did a lot of study on this, and in fact, when you have a root canal on this side, for example, he was a big correlation with that, where patient also developed breast cancer on the same side. So on the left, they also developed breast cancer on the same side. Same thing with thyroid cancer, right thyroid lobe. There was a patient that had a root canal on this side, developed thyroid cancer on the same side. So when they took out the root canal, her recovery was pretty amazing. Cancer, for example, we look at the toxic overload, your acid alkaline balance. As we know, if you have cancer, you want to be in the alkaline side because cancer loves acidic environment. We look at the trace minerals, your vitamins, to see if there's imbalance there. In Swiss biologic medicine, it focuses so much on the internal milieu of a body. We want to make sure that everything is in balance, because we believe that in cancer there's been an imbalance in your internal milieu. Electromagnetic stress, we're always exposed to EMF. Now we've got 5G rolling, so it's coming up. We need to protect ourselves from that. Then for hormonally driven cancers like breast and prostate cancers I've mentioned earlier, I look at the test to see if you have 16 hydroxyestrone imbalance in comparison to hydroxyestrone, and oxidative stress test. We look at oxidation, and usually this test would predict if you already have DNA damage that can tell us, okay, you're prone to develop cancer in the future. So, and then the pancreatic enzymes I've mentioned, that also involves if you have enzyme deficiency, then you cannot absorb the nutrients because some of these pancreatic enzymes needs to be activated by the hydrochloric acid. Again, if you have imbalance there, you have low hydrochloric acid, that could also affect it. Another disease that I would like to point out is, for example, depression. So you go to your physician, you have all the symptoms of depression, you don't have any appetite, you don't have, your libido is down, you feel isolated. In conventional medicine, we right away will tell you, oh, you're depressed, so here is a Wellbutrin or Prozac. Now, we're not deficient in Prozac, or we're not deficient in Wellbutrin. In integrative and functional medicine, we look at the cause of your depression, whether you're eating gluten. Could it be from gluten sensitivity, which will lead to depression? Number two, could it be because you're vitamin B12 deficient? So we'll look into that. Could it be a vitamin D3 deficient? So we'll check you for that. And we look at leaky gut. Again, as I've mentioned, look at this stuff. If you have leaky gut, if you have gut dysbiosis, there are comprehensive tests that we do. Could be a hormonal imbalance, toxic overload. I've seen, before I came here, I was seeing mainly women's health patients came in for depression, and I found out that they have hormonal imbalances. Their estrogen, the progesterone, testosterone are down, and we're exposed to chemicals every day. The xenoestrogens, BPAs, the parabens, these are hormonal disruptors. So there's also a test on that we can do through that we do it here. So again, we look at everything. Another disease that I would like to point out is for cancer. So what caused cancer? I'll look at, again, inflammation. We know that chronic inflammation drives cancer. Chronic infection drives cancer. emotional issues that hasn't been resolved. And in our practice here, we found out that people has a lot of emotional issues in the past that were not resolved. So we have practitioners that does that here. So in that way, we're able to help you, heal properly, because we can do chemotherapy, we can do radiation, but if some of these issues are not resolved, more than likely your cancer will be back. So it's really important to have that holistic approach, your spirituality, your emotional issues. When it comes to spirituality, how are you dealing with your sense of purpose here on earth? That's important. In fact, there was a study that came out that those people with cancer and has religious affiliations as compared to those who don't have religious affiliations, they survive longer. Those people with religious affiliations, they survive longer than compared to those people who don't have religious affiliations. And that's really important because that involves the spirituality, the way you cope with cancer, and the stress. Just being diagnosed with cancer is really stressful stuff that you go through. And another disease entity that I would like to mention is Parkinson's disease. Now, this is interesting because 2 years ago, the Annals of Internal Medicine, which is a conventional journal, which I get it every month, that Parkinson's disease actually is caused by problems in the gut. We've known this in integrative functional medicine, that the leaky gut and gut dysbiosis is, one of the drivers of inflammation that causes disease. And in that research study, it was pretty interesting to know that it is caused by gut dysbiosis and leaky gut. Now we have ways here in our practice how we'll teach you how to help your gut, and we got some supplements to do that. And again, it's a holistic approach. Look at your emotional issues that hasn't been resolved, and the bioimmune survey, the biomeridian, to see if you have some other things that contributed to the inflammation or leaky gut and gut dysbiosis. Of course, nutrition is another part that we can teach about how you're going to modify your diet. I mean, standard American diet, we know that is very inflammatory, causing a lot of problems. So these are the things here in our practice that we look at. And so I hope that we can help you as part of your healing journey, and you can be part of it, and then you can again throw us questions that you might have there. We'll try to answer the best we can, and thank you.